Welcome to our channel, and today we deep dive into psoriasis, what it is, what causes it, and what are the treatment options. When we talk about the term psoriasis, a lot of people get worried because of the kind of information that is there on the social media. So what is psoriasis? Now psoriasis is a condition where there is a change to your immunity and your own body starts to produce a lot more skin in certain areas. So psoriasis is the exact cause of what is the trigger for the immune change is not known. So when a patient presents, when you have psoriasis, how does your skin look? You can have reddish, whitish patches, and if you scratch it, there is a lot of powdery sort of a substance which comes out. So where all can you have psoriasis? This can happen in most of the parts of the skin. It can happen on your scalp, commonly on the elbows and knees, but generally it can happen everywhere. It can also happen a different variant on the nails, on your fold areas of the body, that is your armpit, the thigh fold, etc. So many conditions look like psoriasis but are not psoriasis. So I would recommend that you always check with the right doctor to know whether it is psoriasis. We understood how it presents. There is a reddish, flaky little patch, and you scratch, it's powdery. Sometimes it may not be powdery also. It can just be a soft reddish area which is a little wet and moist. So now coming to what changes have to be done in your lifestyle. Since in allopathy the exact cause is not known, we know the triggers. The triggers are due to stress, due to winters. Also, when you have a little bit of tablets which have beta blockers, antihypertensives or BP medicines, painkillers, now these things can trigger psoriasis as well. So once you have psoriasis, when you visit a doctor's place, you are examined and the confirmation is there. Most of the times a visual confirmation and examination is enough. Sometimes you may require dermoscopy. Dermoscopy is an instrument which helps, like a stethoscope to doctors, dermoscopy is to dermatologists. So we understand the better picture of it when we magnify and we see. Once dermoscopy is done, even skin biopsy in some cases. If you have the psoriasis on the fold areas, sometimes skin biopsies may be required. So once the confirmation of the disease is there, then we go about the lifestyle changes. Now, in allopathy, it is something wherein we don't follow having a lot of food restrictions, but a food which is rich in omega-3 and a food which is reduced inflammatory components is greatly beneficial for psoriasis. So remember to have your green leafy vegetables, your fish, your seeds, walnuts, etc. Reduce intake of milk, sugar, wheat, though not directly, but your gut health is better and this indirectly helps. Now coming to the stress management. Psoriasis is a condition where your mental well-being is very important. So always remember to follow 4 things. That is a good food habit, a good sleep cycle, making sure you're exercising regularly, and also something for your mindset. A meditation 15-20 minutes a day really is beneficial for people. So once your confirmation and lifestyle is in order, next is the applications. We suggest a set of applications depending on the age of the person and depending on the type of psoriasis. Yes, there are so many different types of psoriasis. So people may present just with scalp psoriasis, body is completely free, or they can have just nail psoriasis, other parts are free. So depending on what is the presentation, as doctors we give you medicines which not only control but also maintain it. See, maintenance is a very important term. You can have control of psoriasis, and once it's controlled, people generally tend to stop doing everything. But in this case, you have to maintain it. You have to have a regular routine which will make sure that flakiness is controlled, and also safer ingredients. So in this we give topical steroids, like application steroids, and how much to use, when to stop, and how to maintain is something which you have to properly understand when you visit your doctor. Apart from that, there are certain oral tablets. Now we were talking that this is an immune mediated disease. So immune mediated disease meaning we have to change the immune level of the person. So we have immunomodulators which are very safely given by monitoring the blood of the person. So why you need to take oral medicine? Sometimes there are deep cuts on your palms and soles, you are not able to walk, your quality of life is getting affected. Sometimes there's a marriage or a job. So there are so many reasons why you need to make sure your skin is in a much better state. So once you're done with the oral medications and all this, these usually are enough. Sometimes people get a pigment patch post the psoriasis healing, that we treat with certain creams. Finally, there is something called as phototherapy, light therapy, that also helps. And going forward, the key important thing is how you control and maintain the recurrence and not let it affect the quality of life. So if you suspect you could be having psoriasis, remember that you will have to reach out to a dermatologist who can examine you and confirm. Don't go with the sense of fear. This is something which you can control largely and maintain it through your life. You'll just have to learn a bit about it. So don't go with the wrong information which is available on the net, but go with the right information. And also, this is something you can really control and make sure you live a beautiful quality of life. Do subscribe to our channel to know more about how you maintain your skin health for long.